1 in 5 people in the United States live in rural areas and have limited access to specialized health care, increasing their risk of death. That's according to the CDC. In rural areas, healthcare facilities may only diagnose major issues like heart disease, stroke, and cancer, but lacking the ability to provide definitive care to all patients.
We have excellent resources here, but it is an ongoing struggle in rural communities to fund and stay abreast of current knowledge and to get new personnel in that we need: doctors, nurses, paraprofessional personnel. It is really a battle, but such a necessary battle.
Well, the inability to treat every disease locally does not mean a diagnosis is a death sentence. Having survived Wolff-Parkinson-White syndrome, Coffee County High School student Lily Kramer proves that. WALB News 10's Taylor Lewis looks at her inspiring story and how she's improving health care at the emergency room that saved her life.
According to the U.S. National Library of Medicine, 1 to 3 of 1,000 people will be diagnosed with Wolff-Parkinson-White syndrome. Lily Kramer was just 7 years old when she was rushed to this hospital to learn she was included in that number.
From an early age, Lily experienced heart palpitations, chest pains, shortness of breath, and dizziness, stripping away the simple joys of childhood.
This took away a lot of my childhood. I just wanted to have fun and go do that stuff, but I wasn't able to because I would just feel sick if I did too much movement.
Getting a diagnosis wasn't just overwhelming for her family. It was a major challenge for the staff at Coffee County Regional. In rural communities, hospitals often struggle with limited funding, staffing shortages, and access to the latest medical knowledge.
She was 7. That's very scary. I often tell people in these rural community hospitals, the definition of loneliness is having a sick child, a very, very sick child come in when you're in a very small rural hospital with limited backup.
After uncovering her diagnosis, Lily was sent to 2 different cities in search of treatment. She eventually underwent a successful heart ablation procedure, where doctors use hot or cold energy to destroy small areas of heart tissue, causing the abnormal heart rhythms. That's why she gives back to CRMC Emergency Department, the place she credits with saving her life.
I want to give back because they influenced my life so much by helping me be here today, and I want them to be able to give others the same amazing care that they gave me too.
Lily Kramer was able to turn her diagnosis into a mission. Her campaign will last up until the end of April. Taylor Lewis, WALB, your hometown news source.
And while we're talking about Kramer, so far she has raised over $400 in her GoFundMe campaign to help give back to Coffee Regional Medical Center. The goal so far is to raise $700. Now on our website, WALB.com, we have a link you can follow if you wish to donate to her cause.